Hello everyone, I'm Dr. Maitri Shankar, Associate Professor in Nephrology at Institute of Nephrology, Bengaluru, India, and a member of the ISN Emerging Leaders Cohort 3. Thank you for taking the time to join this session. Today we'll be talking about 8 straightforward evidence-based ways to help individuals protect their kidneys. No matter what your healthcare background is, whether it is nursing, pharmacy, dialysis technician, or primary care, you all have a key role in the kidney health journey. Let's start by remembering why the kidneys matter. They filter waste, balance our body fluids and electrolytes, and even produce hormones that regulate blood pressure and red blood cell production. Yet, chronic kidney disease or CKD is on the rise, affecting millions worldwide. The good news is chronic kidney disease is not only manageable, with the right approach, it's often preventable. And every one of us here, regardless of specialty, can counsel and protect patients at high risk for kidney disease. When it comes to kidney health, staying active is more than just about weight loss. Regular moderate exercise like brisk walks, swimming, or cycling not only helps control blood pressure but also improves insulin sensitivity, reducing the risk of diabetes, which is another major cause of chronic kidney disease. The target is at least 150 minutes a week, but every little bit helps. Encourage patients to find activities they enjoy, and remember, it's never too late to start moving. Next up is diet. Healthy kidneys love variety. Plenty of fruits, vegetables, whole grains, and moderate amounts of lean protein. We want to help patients avoid sodium overload and limit ultra processed foods. For those at risk, be cautious about excess protein, especially from animal sources. Consider collaborating with dietitians for patients who need individualized advice and use every medication review or routine checkup as a teaching opportunity. Diabetes is the leading cause of kidney disease worldwide. Keeping blood sugar under check protects the kidneys. That means regular glucose monitoring, strict adherence to diabetic medications, and a balanced diet. Even minor improvements in glycemic control can delay CKD onset and progression. As frontline healthcare professionals, you're crucial in supporting, encouraging, and tracking patients' progress. Hypertension is often called the silent killer because it damages kidneys, and many people don't even know they have it. Our job is to promote regular blood pressure checks, support medication adherence, and encourage a salt reduced diet. For most adults, we aim for a blood pressure below 140 by 90 or as the doctor recommends. A salt intake of less than 5 grams per day or less than a teaspoon is essential. Remember, teamwork is essential. Nurses, pharmacists, and physicians all play a role in helping patients meet these goals. Hydration is very important for kidney function. Generally, up to 2 liters of water per day is a good starting point, but this must be individualized. People with heart failure or advanced kidney disease might need even less. Staying hydrated helps prevent kidney stones and supports the filtration process. Always ask about the patient's other conditions before making blanket recommendations. Smoking damages blood vessels everywhere in the body, including those supplying the kidneys. Smokers have a much higher risk of both chronic kidney disease and rapid progression to end stage kidney disease. Every healthcare interaction is an opportunity to reinforce a quit attempt or provide resources, encourage and guide patients towards the many supports that are available. It could make a critical difference for their kidney and cardiovascular health as well. Many people are unaware that common painkillers, especially non-steroidal anti-inflammatory drugs like ibuprofen, can cause kidney harm when used regularly or in high doses. Remind patients to check with a healthcare provider before prolonged use of any medication. Review supplements and alternative therapies too. Many can interact or be nephrotoxic. Pharmacists are vital partners in preventing medication related kidney injury. Early CKD has few or no symptoms. That's why screening matters, especially for those with diabetes, hypertension, or a family history of kidney disease. Urine tests for protein and blood tests to estimate kidney function should be routine in these patients. Early detection allows us to intervene before irreversible damage occurs, and you can help by encouraging patients to keep up with their checkups and understand their test results. Let's recap. Prevention is powerful, and these 8 steps are practical, evidence based, and effective for nearly every patient. Physical activity, aerobics or isometric exercise for at least 15 minutes every day or 150 minutes per week. Use of DASH diet, which consists predominantly of plant-based diet with lean meat and low-fat dairy. Salt intake of less than 5 grams per day. Caution with the use of over-the-counter medications like NSAIDs. Avoid steroids, estrogen-containing oral contraceptive pills. Avoid alternative medications. Examples are herbal medications used for weight loss. Stop smoking. In smokers, the first cigarette of the day increases systolic blood pressure by 7%, diastolic blood pressure by 10%, and heart rate by 25%. Recommended alcohol intake is less than 20 grams per day for men and less than 10 grams per day for women. Avoiding alcohol altogether is best. If you're suspecting obstructive sleep apnea, get polysomnography and treat with CPAP. Consider weight loss if BMI is more than 25 kg per meter square. 1 kg of weight loss is associated with a reduction in the blood pressure by 0.5 to 1 millimeters of mercury. Remember, kidney health isn't just the responsibility of nephrologists. All of us are advocates and educators. You can make a difference, sometimes in just a few words during a routine encounter. Preventive measures are effective and practical for all patients. We have to encourage teamwork with nurses, pharmacists, dialysis technicians, primary healthcare physicians. All of us play a vital role. Education and patient empowerment are as important as pharmacologic management. Thank you for your dedication, and together let's help our patients protect their kidneys for life. Here are some of the resources for additional reading. Thank you for your patient listening.